This is totally implausible. House is breaking a foundational principle of clinical ethics. They should not be doing this. This is not a difficult ethics analysis. Legally, this is also assault. House would likely lose his medical license if this actually happened.
Everything points to ALS.
But no MRI. And I want one of them papers to say, I don't want nothing done if something go bad.
A DNR? Mr. Giles, you don't want to rush into...
It's been 2 years. I ain't rushing. I want to sign one. Now. While my arm still works.
So a do not resuscitate order says the patient is declining to be intubated if his throat is blocked. He doesn't want to have chest compressions. He doesn't want to have pressors, any kind of medical stuff, and he doesn't want to have paddles. So when you sign a do not resuscitate order, you're saying, I decline to have any of those interventions in the case where my heart stops or if I stop breathing. One little thing about that is that he says, I still need to be able to sign it. That's not true. Like he could still give a verbal refusal for those kinds of interventions. So like if you have paralysis and you can't sign, that doesn't mean you can't have DNR. So that's a little thing.
O2 sets are dropping.
Blood sounds?
Junkie.
Mucus plug?
No, it's our mistake.
There are never any nurses in this show.
Can't get through his lungs.
Start heparin, 500 cc's IV push.
He won't last long enough for it to work. We've got to intubate him stat.
We can't. It's DNR.
What?
Chase intubated.
He's DNR.
Oh no.
What are you doing? You can't do this.
He saved his life.
Kind of understand the concern behind what motivated this, that they gave him some medication and that caused the patient to have the reaction, and so they were trying to undo the harm that they did. But if somebody has a do not resuscitate order, then that means do not resuscitate. It doesn't mean that you do not resuscitate in particular or specific situations. So House is breaking a very kind of foundational principle of clinical ethics, which is that somebody who has not given consent or who has declined treatment ahead of time, you can't touch them. And legally, this is also assault. So the patient could sue, or that House would likely lose his medical license if this actually happened.
What's wrong with you?
Everyone knows what's wrong with me. What's wrong with him is much more interesting.
You tubed him and he didn't want to be tubed. He has a legal paper saying just that.
To intubate or not to intubate, that is the big ethical question. Actually, I was hoping we could avoid it, maybe just practice some medicine.
There's no question. It's the patient's decision.
If the patient is competent to make it, if his thyroid numbers aren't making him sad.
Oh my God, you don't believe that.
His thyroid levels were a little...
It's nothing. Do not defend him.
Why did he sign that DNR?
I didn't talk him into...
He signed the DNR because he didn't want a slow, painful death from ALS. What was happening to him had nothing to do with his ALS.
House is arguing in this section that the patient didn't have decision-making capacity to actually sign the DNR order. And what House is arguing is that because he had some thyroid issue, that there was some, that meant that he was depressed, and so he wasn't able to actually give consent. This is totally implausible that there's no indication that the patient lacks capacity to be able to make this kind of choice. He's clearly able to understand what was going on, as we saw in the discussion where he asked to sign the DNR form. And just the idea that a patient, even with depression, doesn't have capacity, that's also false. Lots of people believe this, even some healthcare providers believe this, but simply having depression or simply having kind of anything that alters your mood, that's not enough to show that the person lacks capacity. Might be that if it's really extreme that they lack capacity, that they can't actually make an informed decision. But having depression on its own does not mean that a patient can't make a decision. So it has to be to a certain level, and depression, even pretty serious depression in some cases, is not enough to mean that a patient lacks capacity.
So your client forced the patient into this position, and now he wants a court order to force the patient to stay that way.
Without the tube, there's a high likelihood that Mr. Giles will die.
Well, I assume the patient knows that. He had a DNR.
That DNR may not be valid. The patient was suffering from depression brought on by a thyroid imbalance.
The DNR order was witnessed by Dr. House's own staff, Dr. Foreman.
My staff are idiots. I'm sure you know what it's like, Your Honor.
Sit down.
Here, the judge correctly notes that Dr. Foreman, who was there when the patient asked for the DNR, you don't have to do a formal capacity assessment. Those exist, but Dr. Foreman did an assessment just having a conversation with him, had no reason to believe that the patient was unable to give consent.
Start him on Cytoxan.
You're diagnosing Wegener's based on a little inflammation?
Well, unfortunately, I think we've exhausted all the tests we can do in our capacity as the doctors that he doesn't want doing tests on him.
But you don't...
We'll know I'm right if he starts walking.
Can't do any more tests, but you want me to treat him?
Medicine's in the pharmacy. Patient's immobilized in the ICU. Sounds like a simple geography problem.
Are you asking us to jeopardize our medical licenses for this treatment?
This whole episode is just House getting the other doctors to do treatments that the patient has clearly refused. And in this case, they're even aware. They verbally say that they're risking their own medical licenses. So they should not be doing this. This is not a difficult ethics analysis. He's shaking his head no. That's another case of battery. The patient was shaking his head no, refusing with his actions, and House gave him drugs. Didn't give any, there was no informed consent process. House didn't even tell him what drugs he was giving him there, and the patient was refusing it. So in order to make a valid refusal, you don't have to have information. So if a doctor says, hey, do you want this? And the patient says no, they don't have to go through the informed consent process. The bar for refusal is a lot lower than it is for informed consent. But if you give a patient something and you haven't done the informed consent process, if it's not valid consent, then that's assault or battery.
Look, I'm going to take him off the ventilator, and John Henry's going to die. He's accepted that.
Well, I should point out that you can't pull the plug. I have a court order.
You used to.
But I had the right to face my accuser. Judge said so.
Not if no one's accusing you. All the charges have been dropped.
Here's a legal point. It's not up to the victim of something to decide whether the charges get dropped or not. So if I got assaulted, even if I didn't want that person to get charged, that's not up to me. That's up to the prosecutor. So I could tell the prosecutor that I don't want there to be charges, and I could refuse to cooperate, which might lead to the charges getting dropped. But in the United States and Canada, it's not the way it works. People make this mistake all the time, thinking that that whether somebody gets charged or not is up to the victim. That's not true. It's up to the prosecution.
As soon as they pull that plug, he'll die.
I think they would probably do another consent procedure before they went ahead with this.
Ooh. Still breathing.
So 2 sets are holding.
He's breathing.
He's holding his own.
He's still breathing.
It's not Wegener's.
Every episode of the show is just House getting the diagnosis wrong throughout the episode, and then he finally gets it right at the end. So once again, he was mistaken and was giving the patient treatments that the patient didn't want and that weren't actually going to help him.
Okay, life sucks. Your life sucks more than most. It's not as bad as some, which is depressing all by itself. But do me a favor. Just let me find out what's wrong with you. And if you still want to kill yourself, I'll give you a hand. Does that sound fair?
Yeah, sure.
Oh, no.
It's over. I lost my air. The session the other night with those kids, that was a test to see if I could still play. I can't.
And that's all you are? Musician?
I got one thing. Same as you.
There's a lot to unpack in this section. So the first point I want to talk about is that the patient is giving this really good example of a value judgment. So in medicine, the idea of patient-centered care is that people get to decide for themselves whether a treatment or any other kind of medical intervention is worth it for them. Doctors do not have expertise in making judgments about what is worthwhile for patients because those are not medical or scientific facts. Those are facts about what is valuable to our lives. And reasonable people disagree about what it means for something to be worthwhile. So the patient here, John Henry, is a professional trumpet player. And for him, trumpet playing is so important that if he can't play trumpet anymore, then he doesn't want to go on living. That's not the choice that I would make. I'm not a trumpet player, so I might value something else, and other people will value other things. But this is a great example of why doctors should not be in charge of making these kinds of decisions for patients. It should be up to the patient themselves. The other thing is that even if the doctor was better able to make predictions about kind of what would be worthwhile for a patient because they've seen more cases, say, that still doesn't give them the moral authority to make these decisions on behalf of patients. The problem with what House is doing in this episode is not that House is mistaken per se about whether it's worthwhile or not, although I do think that that is that's an issue. The problem is that John Henry, the patient, has the right to make decisions about what happens to his body. That is the principle of autonomy. He can decide what is worthwhile to him. The second thing to talk about is that House, who's like totally happy to override the patient's refusals all the time, also just offered him assisted dying or assistance in dying if John Henry turns out to not be happy with what House does in the end. This is actually a really interesting point because in Massachusetts, where the show is based, they still don't have assisted dying. But one of the interesting things about it is that when John Henry was on the ventilator, then that gives him an opportunity that other patients don't have, including that he doesn't have now. So when he was on the ventilator, he was allowed to remove his consent to be ventilated, in which case the doctors have to remove it. So John Henry still was able to make his own medical decisions. He was receiving treatment in the form of the ventilator, and he was saying, I no longer want to be ventilated, and he can ask for the ventilator to be taken out, knowing that doing so was likely to kill him. In this case, that didn't happen, but if he had died, then that still would have been something that he could give consent for. But this is a problem that patients face in jurisdictions that don't have assisted dying. If they're not attached to a ventilator or in another way, if they don't have the ability to kind of have something removed that will lead to their death, then they're kind of stuck. And this is not really justified. This is kind of by chance. That the ethical difference between John Henry on the ventilator, who is refusing treatment, and there is something that he can refuse that will lead to his death, and John Henry now, who's no longer receiving mechanical ventilation, he can't really turn down treatment in a way that will directly lead to his death. So I don't think that what House is doing is like a fair, an ethical thing to do, to offer him assisted dying if House's investigation doesn't work out. However, it does reveal that there is this ethical tension in jurisdictions where that don't have assisted dying. That it's just by fluke, basically, that John Henry had the right to request his own death by having the ventilator removed. And if he wasn't on a ventilator, as he is now, or as he is not now, then that would mean that he can't kind of ask to have or can't refuse treatment in the same way.
Corey's meeting me outside with a limo. I'm being discharged.
$50 says I can beat you to the curb.
Thanks for sticking with the case.
I can't do anything else.
So, of course, for it to be good television, John Henry is happy with the outcome, and he says, thanks for sticking with the case. Poker players call this resulting, which is that when the outcome works out well, even though you didn't make good decisions. And this is almost every episode of House, where he makes bad decisions, these inferences that aren't really justified, and it ends up working out for him. So in this case, that what would likely happen, or what should happen, is that he should lose his medical license. John Henry should sue him. The prosecutors should still keep prosecuting him, and he'd probably be arrested. So the fact that that didn't happen, makes for good television, but not actually realistic. So if you're watching this and you're involved in healthcare in some way, if somebody has a do not resuscitate order, you should respect the do not resuscitate order. Thank you, everybody, for watching. If there is another episode of a TV show involving clinical ethics that you'd like to see me talk about, please leave a comment below.